In this video, we're talking about shoulder impingement, the different types, and to see what the cause of your shoulder impingement is. There are two types of shoulder impingement: subacromial impingement and internal impingement. Subacromial impingement pain is felt anteriorly, and internal impingement pain is felt posteriorly. Let's see which one you have. To test for subacromial impingement, pain that is felt anteriorly, we have two tests. One is the Neer's test, and second is Kennedy-Hawkins test. The Neer's test: fully internally rotate the painful shoulder and raise it to the ear. If it brings on your pain that is felt in front, this is a positive test. For the Hawkins-Kennedy test, abduct your arm to 90 degrees, fully internally rotate your arm. If this brings on your pain, it is a positive test for subacromial impingement. To test for internal impingement, pain that is felt posteriorly, lie down face up, abduct your arm to 90 degrees and fully externally rotate the arm. Your pain should be reproduced posterior superiorly. Then when the shoulder is relocated into the socket, the pain should go away, and when the pressure is released, the pain sometimes comes back. First, let's talk about subacromial impingement, for pain that is felt anteriorly. This is the subacromial space, the acromion, head of humerus, the subacromial space. The rotator cuff muscles that are made up of 4 muscles run through this space and attach to the head of the humerus or the arm bone. In an impingement, the rotator cuff tendon gets pressed on so much that it gets inflamed and causes pain. Within subacromial impingement, there is primary and secondary subacromial impingement. Primary impingement refers to the bony structure causing the impingement. For example, a more hooked acromion will cause more impingement. However, recent research such as by Gill et al. In 2002 has suggested that there is no significant correlation between bone structure and increased risk of shoulder impingement. The guys over at Physio Tutors did a good video explaining this. I'll link it in the description below. So let's forget about primary impingement. Focus on secondary shoulder impingement. For secondary shoulder impingement, this refers to something else causing the impingement, such as bad posture, repetitive activities, muscle imbalances causing lack of dynamic stability, and tight muscles causing decreased mobility. Remember, we are still talking about subacromial impingement, pain that is felt anteriorly. We will talk about pain that is felt posteriorly later. I've come up with a model that hopefully explains what's going on. This plate represents the shoulder socket, where the humerus bone sits, forming our shoulder joint. Now this is obviously not an exact representation of the shoulder, but it is a rough model to illustrate how the rotator cuff works. These bands represent muscles, pecs and delts, and lats. They pull the humerus to make big movements, while the rotator cuff's job is to keep the head of humerus centered in the socket. When these big muscles are tight or much stronger than the rotator cuff muscles, they are able to pull the head of humerus into positions that reduce space in the subacromial space. They become too tight or overpowering when they are not stretched out, or when we overdevelop them without developing the opposing muscles. When the rotator cuff muscles are too weak to pull the head of the humerus back into place, that is lack of dynamic stability. That's why it needs to be strong enough. All these can be causes of your shoulder pain. Let's test them one by one. Test for weak rotator cuff muscles. The rotator cuff does all kinds of movements, but I am not going to be able to cover all of that in this video. We are just going to test external rotation. Have someone resist. You want to compare your good side with your bad side. If you are weak in external rotation, then you need to strengthen this. Grab a resistance band. You can either do this in kneeling or standing, whichever is more suitable. The next factor is muscles that are tight. These muscles include the pec minor, lats, and delts. All these muscles attach to the humerus. Therefore, they are able to pull the arm and impinge the rotator cuff muscle. First, we test the pec minor. A tight pec minor can pull the humerus or arm bone forward, resulting in less space in the subacromial space. Lie face up. Have someone apply pressure on your coracoid process. If tightness is felt, then your pec minor is tight. We need to stretch it and loosen it up. You can roll it with a lacrosse ball or tennis ball. Roll across the muscle fibers. This is like a massage. Do not roll it too hard. You don't want to give yourself a bruising. Love yourself. You can also do the door stretch. Raise your hands to target the pec minor. To test for lat tightness, lie face up. Our lats internally rotate the arm, so start by internally rotating the arm. Bring it back. Fixate the scapula to make sure it doesn't compensate. Take a note of how far back it goes. Now externally rotate the arm. This puts the lats on a stretch. Bring it back, fixate the scapula and see if it goes back as far as before. If not, then your lats are tight. To stretch it, grab something sturdy with your hands externally rotated. If this is too hard to grip, then just grab it normally and lean away with your hips. Your lats go from your arms all the way to your hip bone. The delts often overpowers the rotator cuff muscles by pulling the humerus upward, causing impingement. A strong rotator cuff, specifically the teres minor, should be able to counter this. Therefore, in this case, it would be beneficial to strengthen the rotator cuff by doing external rotations as mentioned before. Rhomboids and lower traps work to bring the scapula downward. This creates more space in the subacromial space. To test for rhomboids and lower traps weakness, lie face down. For your rhomboids, bring your arms out to the side and have someone resist, or you can even just hold it up and see how long you are able to hold it up for. You want to compare your good side with your bad side. If your arm just falls like that, it is weak. For your lower traps, straighten your arm in front and do the same. If you find weakness, then strengthen it. You can start without weight. You can do this on the floor, bed, or bench at the gym. You can do isometric holds. Hold it for 10 seconds at a time for about 3 to 5 sets to start with. Internal impingement, pain that is felt at the back, is when the rotator cuff gets impinged between the glenoid rim and the humerus. This occurs when you excessively abduct and externally rotate. This happens a lot in overhead athletes such as baseball and cricket players. This is usually caused by a lack of dynamic stability in the shoulder joint. You can do the assessments on muscle weakness mentioned above, such as the rotator cuff weakness. If your injury is still very sensitive and inflamed, you want to ice it for the first day, 20 minutes on and 20 minutes off. Apart from the strengthening and stretching, there are some other useful treatments that have been found to be very helpful in clinical practice. As advised by Dr. Kirsch in his book, Shoulder Pain, The Solution and Prevention, he suggests that hanging opens up the subacromial space. Start with a partial hang. You can use a stool if you are too short. It is important to grip facing forward and keep your head back to avoid neck injuries or pain. You can start with 10 seconds and aim to hang for about 30 seconds at a time and for a total of 10 to 15 minutes a day. If you struggle with the grip, you can also use gloves such as bicycle or golf or gym gloves. If you really can't find anywhere to hang from, Bob and Brad in their YouTube channel talk about the Statue of Liberty pose, where you use a broomstick or any kind of stick, grab it with the arms extended and lean forward. creating a stretch in your shoulder. This opens up the joint. Remember, if any of these bring on your impingement pain, you want to stop doing them and try something else. The second is just rolling your scapula downwards and backwards. Bringing the scapula down will create more space in the subacromial space. This takes a lot of practice and continuous effort throughout your day. It is a scooping motion. It is something that you need to practice every day. If you really like that video, like, subscribe, and leave a comment below. Snakes don't worry about shoulder pain, while red-shouldered hawks are monogamous and mate for the first time at age 2. If their eggs get eaten, they get to try again.